1, 2, 3. Oh my God. So Yogi has not been feeling good.
Yeah.
What's happening?
He's lethargic. He doesn't eat. He does eat, but very slow. He used to be the fastest eater. Now he's the slowest. Might be a tooth. If you give him a treat now, he won't take it.
If you want to hold him for a second, Andy, I'm going to check his temperature. We don't always do temperatures in every single dog, especially if they look healthy, but I want to see if he's got a fever.
The yard is kept trim. And
Are you guys doing any bones or anything like that? Or what's up, baby?
he doesn't like this.
I know he doesn't. I'm going to let you take care of the head end. All right, Yogi, I'm sorry. Gotta do this. Make sure it's on first.
We used to use the match trick on dogs before a race.
Yeah. Oh, so they poop.
Yeah, if you couldn't get Yogi, he wouldn't agree to it.
What Andy's talking about, if you want a dog to poop, you get a book of those matches, the cardboard ones. You go ahead and rip one of the little matches.
Well, the wood matches are better.
Yeah, but if it's a little puppy, it doesn't work as good. And I think the cardboard are a little more forgiving, but it still does a thing. When you rectally stimulate a dog, he'll poop if he has to.
Yeah.
So if you're going on a race with a big sled dog team or even a ski dream team, what you don't like to see, because you're the last dog on the end of the line, when they poop, yeah, they're still running. And sometimes it gets pretty high.
Yeah.
Well, you know, we tell it to people with little dogs, if they're trying to house train them because little dogs don't want to go outside, right after they eat, get a matchstick, but I use the cardboard ones, put on right after they eat, put it underneath with a little Vaseline on tip if you want to be gentle, and they'll poop right away if they have to. The funny thing is you go out and there's all these little poops with matchsticks in them.
He's hot.
Yeah. This is a slow, here it is, 103. A normal temperature on a dog is 101, sometimes 102. So that tells me his body's trying to fight infection. So all his military system is going someplace, probably in his neck. And it's been stimulated by something, possibly a foreign object like a foxtail, which is a piece of grass. It's got foxy things here. And you see how he's swallowing?
Yeah.
I've been watching. It's like it hurts because these things go in and get stuck in the tonsils, and then they go forward, and they're like little barbs, and they won't go backwards. They just keep going and going, and then they get right under the skin, and then they create a big abscess. His isn't a true blown out abscess. I'd say we put him on the antibiotics and a little bit of Rimadyl for swelling, and see if that'll do it. I'm going to get him some Serenia just so he's got an appetite, because sometimes this fever will make him not feel good. That's that anti-nausea, anti-emetic kind of drug, because we want him to keep eating. It usually blows up right here.
That's the skin.
Yeah, under the skin, turns into a huge goiter-looking thing. It's a huge mass. And what Mother Nature would do in the wild, it gets so big it devitalizes an area, and then it would die, and it would just spew on itself. We'd prefer to do it more surgically.
Yeah.
And make it cosmetic, because he has a modeling career, you know. So what we do is we're going to go ahead and get him some treatment, see if it works. It's not at a stage I could surgically try and go in there. If I tried to open up his neck and find that foxtail, I'd have an incision this long and be in surgery for hours. So I'm going to let Mother Nature and his body kind of play with it. We'll give him some antibiotics, and maybe it'll fight it off without causing that huge, gigantic, scary friend on his neck.